Hi, my name is Hannah, and Patrick, Zamzam, and I are going to be giving you a brief overview of what we do as environmentalists working in environmental health within Hennepin County. So we're going to start out by talking about what is an environmentalist, and then we're going to be going through the different program areas that we work in and what we do within them. And you'll be hearing from Zamzam, who's going to be talking about her beach program, as well as Patrick, who will be talking about septic and wells, as well as plan review. And then we're going to end with talking about why we became environmentalists and why we like working in environmental health. So what is an environmentalist? We're also known as health inspectors, sanitarians, environmental health inspectors, lots of different titles, but essentially what we do is we're educators and we educate the people that we work with on the various topics to ensure compliance with the various laws, statutes, and ordinances that we enforce. We're also the people that are essentially protecting people from their environment. We come from a diversity of backgrounds, so a lot of the people in our department have backgrounds in biology, public health, chemistry, environmental health, and different study areas along those lines. We're also all required to take a registered sanitarian exam. Our job duties are primarily inspections, so we inspect licensed and unlicensed activities. Most of the programs areas that we will be talking about are licensed, which means that we license the facility to operate and then we inspect them. So all the inspectors are assigned a work area. So you're given a city or part of a city or a couple cities depending on the size. And then that inspector does all the food, beverage, lodging, and pools within their area. There are also additional program areas that many of us do. So for example, I also do body art inspections and farmers markets and outreach. And so we'll be talking about all those as well, so you can see the variety of work that we do within environmental health. So food inspections is probably the biggest bulk of what we do. We license around 3,300 facilities, so it's by far our largest program area. And we essentially inspect everywhere that sells food, from full-scale restaurants to retail stores that just sell the prepackaged candy at the checkouts, boats, daycares, assisted living homes, all those different places. So the routine inspection frequency depends on risk. So all the different facilities are divided into low, medium, and high risk, depending on the volume of food that they serve and then the complexity of the food being prepared. So for low establishments, those are places that have just the prepackaged food. That's every 2 years. Medium establishments get inspected every 18 months. And then high risk restaurants, that's going to be your full-scale restaurants, are inspected yearly. And then schools are actually inspected twice a year. So some of the photos that we have on the PowerPoint show different tools that we use. So in the top left-hand corner, you can see someone checking a sanitizer concentration using the quat test strips. On the right, you can see that we have a photo of someone taking a temperature using one of our thermometers. Clearly that meat is out of temp and that was thrown away, in case you're wondering. In the bottom left-hand corner, we have a photo of us using our blacklight. And so we use the blacklight to identify evidence of vermin. And so this photo is actually showing mouse urine and feces. So the fluoresced areas is urine. And then the other two photos is an example of us using another tool, which is that being our eyes. So we do a lot of observing when we're doing inspections, and then we also ask a lot of questions, so that way we can see what they know, and then we can also watch what they do, because sometimes they don't do exactly what they say. So this gives you a little snapshot of what part of our inspection report looks like. And so this lists out all the different categories of the things that we look for during inspections. So our inspections are risk-based, so meaning that they focus on the risk factors that may cause illness. Those are going to be your critical violations, which are the ones that are bolded. And those are things such as cooking and cooling procedures, handling practices, ill employees, cleaning, sanitizing, and vermin. So within each of these 38 categories, there's also subcategories of the different orders that we can write of more detailed violations. And so total, there's around 400. So there's quite a bit of things that we're looking for when we're doing these routine inspections. So in addition to doing routine food inspections, we also do a couple other things related to food. One of those is in the summer and in the winter, if they're inside, we inspect farmers markets. We also inspect itinerants and approve those, and those are going to be your special events like festivals when they have food stands. And then we also do food safety classes when requested. And so the photo on the right is a picture of my coworker giving a food safety presentation to a group of community members. And then the last thing on there is HACCP plans, and HACCP is hazard analysis and critical control points, and those are plans for specialized processes that restaurants may do, such as reduced oxygen packaging or sushi rice. And next we're going to have Patrick talk a little bit about plan review.
When a member of the public comes to our office and asks, "How can I start a restaurant?" the answer is always the same: submit a plan. Plan review is the process through which licenses are established for operations at a location, whether it be food, pools, lodging, or body art. At a restaurant, for example, in addition to verifying approved floors, walls, and ceilings, the sinks, sanitary equipment, and facility must match the menu, scale, and processes inherent to the operation. Health officials in plan review work closely with city building officials, state plumbing program, area fire departments, and others to verify that codes are met, and visit the site during construction steps before an establishment is opened.
So another one of our program areas is pools. We license around 470 pools and spas, both indoor and outdoor, and these include public pools as well as spas and pools that are in apartments, fitness centers, and splash pads. So pools are inspected twice a year, and outdoor pools are inspected once before they open to make sure that they're safe and ready to go. And then during our routine inspections, things that we're looking for include the pool chemical levels. So we check the chlorine, pH, alkalinity, and cyanuric acid to ensure that they're at the proper and safe levels using our test kits. And my test kit is pictured down below. It's an example of one of the ones we use to test the chemistry. And then we also look at the pump rooms and mechanical workings of the pool, which is in the photo to the left. And so that's an example of a smaller pump room for both a pool and a spa. And so we make sure that everything there is functioning appropriately. And then we also check the safety equipment such as ring buoys and safety signs and emergency phones to ensure that they're all in working order. We also do incident responses at pools and spas, for example, if there were to be a drowning at a facility. So for our lodging facilities, we license around 130, and these includes hotels, motels, children's camps, sober houses. It does not include assisted living homes and nursing homes anymore. And so the places that we do license get inspected once a year. And during these routine inspections, we focus on a couple different areas. So one of them is pest control. And so we check for evidence and ensure that they're working with the licensed pest control company and have set protocols in place so they don't get any friends, such as the bed bug pictured on the left. And then a new law that just went into effect is related to sex trafficking prevention training. So now all staff have to be trained on sex trafficking prevention. And so we make sure that they're compliant and that they have the proper resources they need. And then we also look at cleanliness, and this includes cleanliness of the rooms, as well as making sure that they're changing the linens frequently enough, that they're sanitizing any food contact surfaces that may be in the room, such as coffee pots or cups. And then we also look at just general good repair of the physical facilities and the rooms, and that includes any furniture or other equipment that may be present. And then we also work with the facility and other officials if there's any larger issues present, such as mold, which is the photo on the right, hoarding, which we'll talk about a little bit later, as well as any emergency situations, such as floods from pipes bursting, fires, sometimes both. So in any of those situations, we work with whoever we need to get the place back up compliant and open again if they had to close. So body art is one of those program areas I don't think a lot of people associate with environmental health, but it definitely does fit within that category. So body art includes tattoos, piercing, and permanent makeup. So when we're doing our inspections on body art, we are mainly focusing on ways to prevent transmission of bloodborne pathogens such as hepatitis B and C and HIV. So during our inspections, the main things that we're looking at is sterilization. So we're seeing if they're using disposable needles or if they're using an autoclave to sterilize their own to reuse them. And if they are using an autoclave, we test it to make sure that it is working, and we send results to a lab, and then we check their records to make sure they're also checking their autoclave monthly. And then we also look at bloodborne pathogen prevention, which includes checking the training and certifications of the artists that are working there, making sure they're all up to date, also checking their disposal procedures they have in place for anything that may have contact with bodily fluids, using the appropriate biohazard procedures, and then also looking at their procedures they have to prevent contamination, using protective equipment and covering surfaces, things like that. We also do a client record review to check and verify that people are of the appropriate age, also checking the consent forms to make sure they have the appropriate disclaimers and are asking the correct questions, and also providing appropriate aftercare instructions. And then we also run through their cleaning procedures to make sure they're using the proper chemicals and that they're cleaning at the appropriate frequency. Next, we're going to have Zamzam talk a little bit about beaches.
During the summer, we collect beach water samples to test for E. coli to measure the risk of contracting illnesses from recreational exposure to beach water. E. coli is an indicator species, so when those levels are high, it indicates there could be a high enough level of other pathogens present to cause illnesses. When the E. coli bacteria levels exceed the guidelines set by the U.S. Environmental Protection Agency, Hennepin County Public Health recommends beach closure until subsequent sample results show a level within the acceptable range. Also, we have a website that we update with results with a link on the PowerPoint, so if you want to check those out, you can.
Our agency is delegated by the Minnesota Department of Health to ensure any of the businesses that we license have an approved source of water for service to the public. Businesses that are not connected to a municipal water supply must also meet the National Primary Drinking Water regulations under the Safe Drinking Water Act. Environmental health workers sample these wells annually to monitor for bacteria, nitrate, and nitrite, as these are indicators to a pathway of contamination. Specifically, our program covers transient non-community systems, which is a public water supply that regularly supplies water to at least 25 of the same people at least 6 months of the year. In addition to sampling and monitoring, site visits or sanitary surveys are performed to identify any deficiencies or problems such as a plumbing cross-connection in the distribution system. The bottom middle photo is a typical distribution system where water comes in from the well casing, is pumped into the light blue hydropneumatic tanks in the back, filtered through the black filter casings on the right hand side, and then softened through the front tanks. An annual startup procedure is required and documented, which includes sanitizing and flushing the system for seasonal systems such as a golf course. Look for public notification on site from the health department in the event of any bacteria incident. The picture on the upper right is a diagram of a typical residential septic system. Sewage enters the septic tank through a gravity sewer pipe from the house. Solids settle out in the tanks, and effluent wastewater from the septic system is distributed through laterals down into the soil where any harmful bacteria or viruses are inactivated as the water percolates through. The county is delegated by the Minnesota Pollution Control Agency to ensure that septic systems meet the requirements of Minnesota Rule Chapter 7080. This includes analyzing the soils for proper separation, verifying system sizing, which for houses is based on the number of bedrooms, and making sure that the location is set back from any areas of concern, including property lines, buildings, and wells. Once the design is approved, a permit is issued and county inspectors join installers on site to verify proper construction. We have systems in the county that have been working well for over 30 years, but they only work as long as they are maintained. Tanks must be pumped every 3 years or so. As a reminder, never flush solvents or toxic chemicals into a septic system.
So if septic systems are left not maintained well, then they can end up turning into a public health nuisance, which is what we're going to talk about next. So public health nuisance is any activity or failure to act that adversely affects the public health, and this includes conditions that pose an immediate and direct hazard to human health if they're left unremediated due to the existence of the condition itself or due to the immediate threat of transmission of disease through insects, animals, or other means of transmission or infections. So this is going to include hoarding, garbage houses, clandestine lab sites, which is meth, unkempt pools, or a failing septic system. So the goal of environmental health in these situations is to prevent injury and illness to the occupants of the property and also to the public, especially children and vulnerable adults. So even though some of these situations are in private homes, it can still affect the public because we want those that may have to enter the home or property, such as emergency personnel like firefighters, EMT, police, or even utility workers like plumbers and electrician, to be able to enter the home and do so safely without their health being compromised while they do their job. So with these types of situations, we work really collaboratively with city officials, police, adult and child protection, animal protection. Sometimes SWAT's been involved. So they're very difficult situations and are definitely maybe one of the harder things that we do, but they do have a positive impact on people in the end. Some of the other areas that we work in that haven't been mentioned includes complaints, and so any complaints that we receive regarding any of our facilities that we license or any of the areas that we work in, we investigate. We also do outbreak investigations, and so for those, we work really collaboratively with our epidemiology department and the Minnesota Department of Health. And so the environmental health duties during an outbreak is we do the on-site investigation. So we go to the facility and do risk-based inspections, implement corrective actions if we need to. We also interview all the employees and then do any follow-up if needed. And for tobacco, we recently did a study to find ways to reduce youth access to tobacco at retail facilities. And then we also do some tobacco inspections in a few cities that don't currently have their own programs. For radon, we sell test kits at our main office and then provide education and mitigation resources if requested. Then we also do lockup inspections, and so these are going to be inspections of jails. They're a little bit different from the things that we do. It's kind of a combination of lodging and food. We check for cleanliness, first aid stuff, food provided, things like that. And then the last one is kind of a fun one. So we work with the Minneapolis Department of Health and other different jurisdictions that we don't work in if there is any larger events that they need help with. So for example, the Super Bowl. So we helped Minneapolis with food security and food safety during that event.
There are many reasons people have been drawn to environmental health work over the years. We surveyed a few of our colleagues, and this slide presents a few ideas what they had to say. To me, this is meaningful work that has a positive impact on the health of my community.
For me, I like that there are many different areas of environmental health, and they're always changing, which always gives learning an opportunity to learn something new. Every day is different, and knowing you're making a difference in people's lives, protecting the public every day is a rewarding job to do. So if all of this sounded really interesting to you and you would like to try it out, you can shadow an environmentalist. So we offer shadowing opportunities for anyone that's interested. You can contact our main office. I have our contact information on the slide, and then it's also on the next slide. If you have any questions about it, where you can come and shadow an environmentalist on an inspection or two and see what it's like doing our job.